Understanding kidney stones. Kidney stones are hard mineral and salt deposits that form inside your kidneys. They can cause severe pain and discomfort, and if not managed properly, may lead to more serious health issues. Understanding what causes kidney stones, how they form, and what can be done to prevent them is crucial for maintaining good kidney health. This video will drill into the causes, symptoms, risk factors, and prevention strategies for kidney stones. What are kidney stones? Kidney stones, also known as renal calculi, are solid masses made of crystals. They usually originate in your kidneys, but can develop anywhere along your urinary tract, including the kidneys, ureters, bladder, and urethra. Kidney stones can vary in size, from tiny particles that pass unnoticed to large stones that cause significant pain and may require surgical intervention. Types of kidney stones. There are several types of kidney stones, each with different causes. Calcium stones. These are the most common type of kidney stones and are primarily made of calcium oxalate. Calcium stones can also be composed of calcium phosphate. Struvite stones. These stones form in response to an infection, such as a urinary tract infection, UTI. They can grow quickly and become quite large. Uric acid stones. These stones form when your urine is too acidic. They are often associated with a diet high in purines, substances found in animal proteins. Cystine stones. These are rare and form in people with a hereditary disorder called cystinuria, which causes the kidneys to excrete too much cysteine, an amino acid. Causes of kidney stones. Kidney stones form when your urine contains more crystal-forming substances, such as calcium, oxalate, and uric acid, than the fluid in your urine can dilute. At the same time, your urine may lack substances that prevent crystals from sticking together, creating an ideal environment for kidney stones to form. Here are the primary causes and contributing factors for kidney stones. Dehydration. Description. Dehydration reduces urine volume, which increases the concentration of stone-forming substances in the urine. How it happens. When you are dehydrated, your kidneys produce less urine, which means that the urine becomes more concentrated. This concentration allows minerals and salts to crystallize and form stones. Prevention. Drinking plenty of water throughout the day is essential. Aim for at least 8 8-ounce glasses of water daily, more if you are physically active or live in a hot climate. Diet. High oxalate intake. Foods high in oxalate, such as spinach, nuts, and chocolate, can contribute to the formation of calcium oxalate stones. High sodium intake. A diet high in sodium can increase the amount of calcium your kidneys excrete, which can lead to the formation of calcium stones. High animal protein intake. Eating large amounts of red meat, poultry, eggs, and seafood can increase the level of uric acid in your urine, leading to uric acid stones. Low calcium intake. Contrary to what might be expected, a diet low in calcium can lead to kidney stones. Calcium binds to oxalate in the intestines, preventing it from being absorbed into the bloodstream and then excreted in the urine. Prevention. Maintain a balanced diet with moderate amounts of animal protein, sodium, and oxalate-rich foods. Ensure adequate calcium intake from dietary sources rather than supplements. Obesity. Description. Obesity is a significant risk factor for kidney stones. How it happens. Obesity can change the acid levels in your urine, leading to the formation of stones. Prevention. Achieving and maintaining a healthy weight through a balanced diet and regular exercise can reduce your risk of developing kidney stones. Medical conditions. Hyperparathyroidism. This condition involves overactive parathyroid glands, which can lead to high levels of calcium in your urine and the formation of calcium stones. Renal tubular acidosis, a condition where the kidneys fail to excrete acids into the urine, causing the blood to become too acidic and leading to the formation of kidney stones. Cystinuria, a hereditary disorder that causes the kidneys to excrete too much cysteine, leading to cystine stones. Inflammatory bowel disease, IBD. Conditions like Crohn's disease and ulcerative colitis can increase the risk of kidney stones due to changes in how the intestines absorb calcium and other substances. Gout, a type of arthritis caused by high levels of uric acid in the blood, leading to uric acid stones. Prevention. Managing these medical conditions through appropriate treatment and lifestyle changes can help reduce the risk of kidney stones. Family history and genetics. Description. A family history of kidney stones can increase your risk of developing them. How it happens. Genetic predispositions can affect how your body processes minerals and other substances that can lead to the formation of kidney stones. Prevention. While you cannot change your genetics, being aware of your family history and taking preventive measures such as staying hydrated and maintaining a balanced diet, can help reduce your risk. Medications and supplements. Description: certain medications and supplements can increase the risk of kidney stones. Common offenders: diuretics, water pills, calcium-based antacids, certain antibiotics, topiramate, a medication used to treat seizures and migraines, excessive use of vitamin C and calcium supplements. Prevention: use medications and supplements only as directed by your healthcare provider. Discuss potential risks with your doctor, especially if you have a history of kidney stones. Symptoms of kidney stones. Kidney stones may not cause symptoms until they move around within your kidney or pass into your ureter, the tube connecting the kidney and bladder. When symptoms do occur, they can be severe. Common symptoms of kidney stones include severe pain, intense pain in the back or side below the ribs that may radiate to the lower abdomen and groin. Pain during urination, a burning sensation or pain while urinating. Frequent urination, a persistent need to urinate more often than usual. Cloudy or foul-smelling urine, urine that appears cloudy or has a strong odor. Blood in the urine, pink, red, or brown urine indicating the presence of blood. Nausea and vomiting, feeling sick to your stomach or vomiting. Fever and chills, often a sign of an infection, which can occur alongside kidney stones. Diagnosing kidney stones. If you suspect you have a kidney stone, it's important to see a healthcare provider for a proper diagnosis. Diagnostic methods include imaging tests. CT scans, X-rays, or ultrasounds can help locate the stones and determine their size and shape. Urine tests. A 24-hour urine collection can reveal high levels of stone-forming minerals or low levels of stone-preventing substances. Blood tests. Blood tests can identify high levels of certain chemicals that can form stones. Treatment options for kidney stones. Treatment for kidney stones depends on the size, type, and cause of the stones. Here are the common treatment options. Small stones with minimal symptoms. Hydration. Drinking plenty of water can help flush out small stones through the urinary tract. Pain relief. Over-the-counter pain relievers like ibuprofen, acetaminophen, or naproxen can help manage pain. Medical therapy. Medications such as alpha blockers can relax the muscles in your ureter, helping pass the stone more quickly and with less pain. Large stones or stones causing symptoms. Extracorporeal shock wave lithotripsy, ESWL, uses sound waves to break stones into smaller pieces that can be passed through the urine. Ureteroscopy. A thin tube with a camera is inserted through the urethra and bladder to the ureter, where the stone can be removed or broken up. Percutaneous nephrolithotomy. Surgical removal of large stones through a small incision in the back. Parathyroid surgery. If kidney stones are caused by overactive parathyroid glands, surgery to remove the glands may be necessary. Preventing kidney stones. Preventing kidney stones involves lifestyle changes and, in some cases, medications to reduce the risk of recurrence. Here are some effective prevention strategies. Stay hydrated. Description: drinking enough fluids, especially water, dilutes the substances in urine that lead to stones. Recommendation: aim for at least 8 to 10 glasses of water a day, more if you are physically active or live in a hot climate. Monitor your urine color. It should be light and clear. Dietary modifications. Reduce sodium intake. High sodium levels can increase calcium in the urine, leading to stone formation. Aim for no more than 2,300 milligrams of sodium per day, and even less if advised by your doctor. Limit oxalate-rich foods. Reduce intake of foods high in oxalate such as spinach, beets, nuts, and chocolate. Moderate animal protein. Limit the amount of red meat, poultry, eggs, and seafood in your diet to reduce uric acid levels. Increase calcium intake. Ensure you get enough dietary calcium. Aim for about 1,000 to 1,200 milligrams per day from food sources. Eat citrate-rich foods. Citrate, found in citrus fruits, can help prevent stone formation. Include lemons, oranges, and limes in your diet. Medication. Thiazide diuretics help reduce calcium in the urine. Potassium citrate can increase citrate levels in the urine, preventing stones. Allopurinol, used to reduce uric acid levels in the urine for people prone to uric acid stones. Lifestyle changes. Maintain a healthy weight. Obesity is a risk factor for kidney stones, so maintaining a healthy weight through diet and exercise is important. Monitor medication use. Be aware of the potential side effects of medications and discuss alternatives with your healthcare provider if necessary. Regular checkups. Regular medical checkups can help monitor your kidney health and prevent complications. Kidney stones are a painful and often preventable condition. Understanding the causes and risk factors Recognizing the symptoms and implementing effective prevention strategies are crucial steps in managing kidney stones. By staying hydrated, maintaining a balanced diet, managing your weight, and seeking appropriate medical care, you can reduce your risk of developing kidney stones and maintain good kidney health. If you experience symptoms of kidney stones, it's essential to seek medical attention promptly to receive the appropriate treatment and prevent complications. If you received value from this video, please like and subscribe to the channel.